Okay, if you have diabetes or you care about someone who does, we really need to talk about feet. I know, it might not sound like the most urgent topic, but diabetes-related foot disease is actually one of the most common and, frankly, one of the most dangerous complications out there, and it often starts silently, which is exactly why understanding the risk is so critical. So let's break down what you need to know. We're going to walk through this step by step. First, we'll get a handle on the true scale of the problem. Then, we're going to trace the path that leads from a totally healthy foot to a dangerous ulcer and see what happens when an infection takes hold. After that, we'll cover the 5 absolute keys to healing, and we'll wrap up with the most powerful part, how we can prevent this from ever happening in the first place. All right, so let's just start with how common this really is. Because to understand the risk to our feet, you first have to understand the sheer scale of diabetes itself. Get this, as of 2021, over 500 million people around the world were living with diabetes. That is a staggering number, more than the entire population of the United States and Russia combined. So, you see, this isn't some niche issue. It's a massive global health crisis, and it sets the stage for the specific risk we're talking about today. Now, that giant global number can feel a little abstract, right? Well, this is where it gets incredibly personal. If you have diabetes, your lifetime risk of developing a foot ulcer is as high as 1 in 3. Think about that. This isn't some rare, fringe complication. It's a core risk of the disease. So, what do we even mean when we say diabetes-related foot disease, or DFD? The easiest way to think of it as a big umbrella term. It covers the whole spectrum, from the initial nerve damage and poor circulation, all the way to the ulcers, the infections, and in the most serious cases, the amputations that can result from them. And this right here, this is why taking foot health so seriously is absolutely non-negotiable. Over 80% of amputations in people with diabetes don't just happen out of the blue. They start with a foot ulcer. That's huge. It means if we can prevent the ulcer or treat it early, we can prevent the vast majority of these life-changing outcomes. The whole key is stopping it right at that first stage. So, how does this actually happen? How does a foot, which is designed to be so tough and resilient, become so incredibly vulnerable? Well, it's not one single thing failing. It's really a dangerous combination of factors that can quietly build up over a long time. It really boils down to 2 main culprits that create a perfect storm. On one side, you've got sensory neuropathy, which is just a fancy way of saying damage to the nerves that let you feel things. On the other side, you have peripheral artery disease, or PAD, which means you have poor blood circulation. When you have both of these going on, the foot loses its ability to feel harm and its ability to heal from it all at the same time. The process usually unfolds in 3 steps. First, the neuropathy kicks in and you lose that protective sensation. You just can't feel pain or pressure or heat and cold the way you used to. Second, because you can't feel it, a minor, repetitive injury, like maybe a shoe that rubs just a little bit, goes completely unnoticed. And third, that constant, unfelt pressure eventually causes the skin to break down, and that's when an ulcer forms. This is the absolute central idea to get your head around. A simple activity like walking can become dangerous because the foot's natural alarm system, that sensation of pain, has been switched off. The very shoes that are supposed to protect you can actually become the source of the injury, slowly and silently damaging the skin day after day without the person feeling a single thing. So now we have an ulcer, a break in the skin's defenses. This brings us to the next really critical stage, because an open wound isn't just a sore. It is literally an open door for bacteria. Let's take a look at what happens when that ulcer gets infected. Okay, here you can see an ulcer starting to form. See that thick yellowish ring around it? That's a callus, and it's a dead giveaway for a spot that's under constant high pressure. Now, at this stage, it might not be infected, but that break in the skin is a direct entryway for any bacteria hanging around. Sometimes, other things can make the situation even trickier. This ulcer, for example, is in the middle of the foot, which is not a typical spot. It's caused by a condition called Charcot's arthropathy, where the bones in the foot actually get weak and fracture, causing the whole arch to collapse. This creates brand new pressure points that shouldn't be there, making ulcers more likely and way harder to heal. And this, well, this is what can happen in a worst-case scenario. The infection started in that toe, which has become gangrenous. That means the tissue has actually died. But look closely at the redness spreading up the foot. That is a terrifyingly clear picture of how fast and how aggressively an infection can travel, putting the entire leg and even a person's life at risk. So with all this going on, how do doctors assess the risk in a systematic way? Well, they use scoring systems like this one called Sinbad. Now, you do not need to memorize this table. The whole point is to give healthcare teams a simple, standard way to classify how severe an ulcer is. They just look at 6 key things: its site, whether there's ischemia, neuropathy, bacterial infection, its area, and its depth. A higher Sinbad score basically means a higher risk and a tougher road to healing.
Okay, now for the good news. We understand this disease and there is a very clear, evidence-based roadmap for treatment. Let's dive into the 5 keys to healing.
Modern treatment is really built on these 5 pillars. 1, debridement, which is basically cleaning out any unhealthy tissue so the healthy stuff can grow. 2, using the right kind of dressing to protect the wound. 3, and this one is a massive deal, offloading. That means taking all the pressure off the ulcer, usually with a special cast or boot. 4, getting any infection under control with the right antibiotics. And 5, if the circulation is bad, doing procedures to restore that blood flow. You really need all 5 of these working together. This diagram is a great way to see how that care is tailored for each person. It's called the WIFI classification system, and it helps the medical team figure out what the main problem is. Is it the wound itself? Is it poor circulation, the ischemia, or is it the foot infection? By pinpointing which factor is driving the problem, they can create a super specific treatment plan that's right for you. So at the end of the day, the goal is always a positive one. With a great team and a solid plan built on those 5 principles, the focus is crystal clear. Heal the ulcer, stop any infection, and ultimately save the limb. And that brings us to our final and, I think, most important section. Because as good as our treatments are, preventing the problem from ever starting is always, always better. Let's talk about the power of prevention. So what is the single most important thing you can do? It's this: regular, proactive screening. This isn't about waiting for a problem to pop up. This is about having a healthcare provider, whether it's your doctor, a podiatrist, a specialist nurse, check your feet on a regular basis. This is the absolute cornerstone of preventing serious complications before they ever get a chance to start. And that screening isn't one size fits all. The international experts have these really clear risk categories. So if you have no risk factors at all, an annual check is probably fine. But as soon as risk factors like neuropathy or poor circulation show up, the recommended frequency of those checks goes way up, to as often as every 1 to 3 months for people who are at the highest risk. This is real, actionable information you can talk to your doctor about. We've covered so much today, from the huge global scale of this problem right down to the microscopic path a single bacterium can take into a wound. We've seen how a simple spot of pressure can turn into an ulcer, but we've also seen the clear, proven path to healing and recovery. The most important thing to take away from all of this is that you have the power to intervene. So I'll leave you with this question. Knowing everything we've just discussed, what is one simple step you can take today to prioritize your foot health? Is it taking 30 seconds to check your feet before bed? Is it taking a really close look at the shoes you wear every day? Or maybe it's making that call to schedule a screening. The power of prevention really is in your hands,